Dear viewers, welcome you all to our show, OSA Orthopedic Solution Academy. I hope you all are well during this COVID-19 pandemic situation by wearing mask and keeping distance with each other. Dear viewers, today our topic is the cosmetic Ilizarov. That is a fantastic topic. By using this magical Ilizarov, we can do the stature lengthening. And our speaker is Professor Novikov sir from Russian Institute of Ilizarov, Kurgan, Russia. And we have two academic experts, Professor Mofakharul Bari sir, the pioneer Ilizarov surgeon in Bangladesh, and definitely Dr. Shamsul Huda sir from Patna, India. I would like to welcome all of them to join with us. And I would like to request Professor Novikov sir to start his presentation regarding the cosmetic Ilizarov, the stature lengthening. Professor Novikov sir, would you please start your fantastic presentation?
Thank you very much for your invitation. Thank you for possibilities little bit share with our experience. This is, you're absolutely right, interesting topic. And like any methods of treatment, he has some interesting page. Let me start from our father, our genius, Professor Ilizarov. This year we will celebrate 100 years since his birth, 70 years of his baby, Ilizarov apparatus and methods, and 50 years of our center, biggest orthopedic center in the world, in small village, in small town. And in the history of the world, people of low stature have extended at all the time. And so many variants of treatment for increased height. All of doctors from all over the world try, but cannot really support for these people. And cosmetic lengthening, I won't start from dwarfism, because all of this knowledge, all of these skills, all of this technique coming from methods of support for patient with achondroplasia. On this slide, so many great surgeons give us information about everything of body with achondroplasia, but only few person give us knowledge about orthopedic treatment, orthopedic support. Before Ilizarov, we can help only with correction deformity, nothing more. Was only social support. And Ilizarov was first, and I was first chief of department, this unique department. On 5th of September 1983, Ilizarov opened the world's first department of growth regulation. And from all of the world, from Italy, Bulgaria, Spain, Cuba, Iceland, Poland, France, Saudi Arabia, Iran, Egypt, patient, and so many countries come for treatment. And here you can see some aspects. When we start treatment, you can see severe valgus on, this is my patient from Italy, Sessa Marca. Just now he is president, biggest of association of short people in the world, ISAC. And Ilizarov start support with lengthening. And now more than 1,000 patients with achondroplasia have been treated in our center. And we solve problems like defect of damage of biomechanics. This is number one. Then aesthetic needs and some social, domestic, and psychological problems. And this is depend when patient come for us. This is baby, 5, 6 years old, or this is adult, 35, 40 years. And we take into account such aspects of medical and social rehabilitation as biomechanical, ergonomic, aesthetic, and where ergonomic problems of the patient with shortening of limb segments occur. This is personal computer operating, driving the car, sports, physical activity, everyday activities. And what we need improve. This is easy access to control and directing system, easy access to overview and control of detecting system, easy access to security system. And remember this picture, very strange and very, very important, because this is estimation of bone tissue destruction potential. Usually we see only X-ray and don't think about what is it X-ray around of this picture. And we use like radiography, ultrasound, digital bone density analysis, evaluation of destruction potential of soft tissue ultrasound, AMG, measuring of absolutely and relative volume of the extended segment, and evaluation of patient rehabilitation capacity, control of range of motion in adjustment joint, exercise therapy, soft tissue ultrasound, muscles, AMG. Remember this picture. And Ilizarov start to lens touch first tibia on the one level, but haven't time because so many patient wait his support, and the next step was bifocal lengthening. If we touch simultaneous two tibias, on the next stage we need touch femur, one femur, another femur. This is two stage to the femur. Ilizarov try in one stage lens unilateral femur and tibia, but for me this is not so good variant because very big tension near the knee joint, and after this treatment knee joint never back to the normal life. Then coming another unique variant, simultaneous lengthening contralateral tibia and femur. And now usually all of patients go through this technique. I already show this picture. This is like historical. Patient from Hungary, another patient from Hungary, very difficult simultaneous lengthening of two femur. Another guy from Russia, patient from Iceland, patient from Ukraine. Heavy time. And please not follow this way. Only calculate how many fractures, 1, 2, 3, 4, 5, 6. Too much for one patient. This is patient from Poland. All patient is satisfied, but this experience give us knowledge, and just now my recommendation, go for support step by step. One segment, then another segment, take rest, and like that. And when we have enough experience, same time, near 40 years ago, oh, very good picture. This is Cessa Marca from Italy. This is Alghieri from Italy. Kamal Hosni, Gaucher from France, Novikov, Dror Paley from India. Support, I forgot his name. And all of this doctor use external fixator, and association of patient with achondroplasia invite us for his conference. And Jacques Caton, this is slide from him I took, explain of his experience that we can support with increase of height only patient with medicine problem, and he never touch a patient without medicine deformity or shortening or discrepancy. And he all time says never touch cosmetic patient, because we don't know how we will finish of this treatment. And many years ago, this is data when first time in the world Ilizarov touch healthy person. This is Paola Magherini from Italy, and I was doctor. Ilizarov was surgeon of this guy. We finished lengthening after 14 centimeters. Patient, very heavy treatment, 8 osteotomies. I can say this is terrible treatment, because double speed, 1 millimeters for each level, upper side, lower side, and 8 fracture each day, 4 times. This is heavy treatment. Now in the world we have so many different technique, including intramedullary technique for lengthening, some external fixator, but I prefer Ilizarov methods, because this is almost bloodless and low intensive surgery. Colleagues, did you hear me? Colleagues?
Yes, so we can hear you, sir. Please continue, sir.
Yeah, and this give us possibilities during the treatment anytime correct some problems and go away from this problem. And when we touch cosmetic person, cosmetic patient, we need to think about golden ratio, golden proportion, because little bit later I will show what is the golden section of Leonardo. Закройте, пожалуйста, дверь. У меня международный вебинар. And here you can see golden section and formula when we calculate how many amount of our lengthening. But some patients not satisfied with that, because for proportional, very short amount we need. Just now example of lengthening. For example, if initial heights before treatment was 150 centimeters, and we very easy can calculate This is number 1.5. But for gold section, we need 1.62. Then we can calculate how many centimeters we need length his tibia for our gold. Here I want to show some proportional results. Before treatment, her height was 168, after 172. But patient want before surgery 10 centimeters. When we calculate her span, her win was 172. And he follow me. I motivate her only for 5 centimeters. And patient just now on the inside of gold section of Leonardo. Another guy from Australia, he come and he has the idea, I want maximum. And I was crazy doctor because I follow his plan. I am not stop him. Just now, 15 years ago, I was satisfied because near 14, 13.5 centimeters, we increase his height. Before treatment, he was 159. After treatment, 172. And patient happy. 15 years ago, I was happy. Today, I'm unhappy. Why? Because I not improve his life. For jump, for moving, for car, for commode. This is amount on lengthening disturb for everything. Stupid idea, little bit stupid data, and stupid result. Remember this picture and not follow. We can finish lengthening only with medicine propose, medicine calculation. And if we can back proportional for all of part of body, this is disproportional result. This is, I can say, this is complication. But patient haven't any orthopedic complication, but this is complication. And you can see proportional result from Russia, same data, but disproportional result not so good. This is bad result. And sometimes when doctor show his result, oh, I know won't, but patient won't, I can say, patient buy doctor. This is bad money. Not take this example and not follow this example. And usually when we touch cosmetic patient, it's more than enough, one level, 4, 5, 6, till 8 centimeters, if you will lengthening very slowly, because many years ago we request till 5 centimeters, one level. If you want to increase height or patient need to increase height for 8, 10 centimeters, must 2 level. 2 level more heavy and soft tissue not tolerate this speed of lengthening. 2 millimeters for each day, impossible for adult patient. Please remember. And usually all of patient with any problem after surgery satisfied. Why? Because from one level, from one floor, for example here, 160. After treatment, little bit, but he is higher than 170. And patient happy, more than happy. But remember about function of all of joints, biomechanical issue. And during this treatment, many years we try find some support. What will be to do short period of healing, including wire with hydroxyapatitis, which we put in intramedullary. My experience, nothing helped. This is like pregnant. Time for healing is time for healing. If you will to do short, I think this will not result from God time. This is my experience. Maybe I am wrong. Maybe this is my mistakes. But just now, for my patient, I never use. For me, bone marrow, this is holy cow. I no want touch and disturb mother of future bone. And all of these patients, not too short period of treatment with any stimulation. And any our activities with cosmetic surgeon, please remember, first, do no harm. Premium nil nursery, because sometimes, like this is pretty girl, come for 3 centimeters for lengthening, and everything finished with very bad result, with osteomyelitis, with subluxation both of feet, with severe scars, all part of where was wire. And then patient spent, this is patient, not my patient, this is patient from Ukraine, from good doctor, but you can see which kind of result. This is another way when patient lost life according of this procedure. Why? Because doctor and patient think only about amount of lengthening, not about function of joint, not about position of foot. All period of treatment, patient stay in the bed, never walk. This is not Ilizarov methods. This is not Ilizarov frame. I don't know what is it, but patient thinks this is Ilizarov methods, because if patient cannot touch floor, if patient haven't 90 position of 90-degree position of foot, Ilizarov immediately stop of this procedure. If patient can touch, if patient can move here, if patient cannot unbend knee joint, we can continue. If no, we not just now follow idea of patient, I need 5, 6, doesn't matter how centimeters patient need. We need to think about future. We need to think about improvement of life, because centimeters not give improvement of life. Then when we not follow principle of Ilizarov, I can say this is already mistake, and complications will come, because so many times Ilizarov methods, this is not same of apparatus of Ilizarov, because sometimes Ilizarov methods, this is hip support. Ilizarov methods, this is sometimes monolateral. Doesn't matter which kind of frame, EO or Hoffman or Wagner. And in other way, sometimes apparatus of Ilizarov, this is not same of method of Ilizarov, because with Ilizarov frame, patient not walk, patient not move of joint, and system of this apparatus haven't hinge, and doctor cannot correct some small deformity. And ideal situation when doctor use apparatus of Ilizarov, and this is equal, same of methods of Ilizarov, and result will magic. And in other way, this is must very good communicate doctor and patient. If patient follow instruction of doctor, we have magic, fantastic result. During the treatment, you can see joint is good, position of foot is good, patient have enough activities, and result will excellent. And we not simulate, because for healing any body need minimum 2.5 3 months, and we spent all of these months, all of this time for excellent healing. And all of this bad experience, heavy, dark experience, just now give us knowledge, give us understanding for this period, for this concept of treatment cosmetic patient. Now I will little bit explain. We during the treatment, same amount of lengthening, many years take different results, and we start think why. Because one patient 5 centimeters, another patient 5 centimeters, but result is absolutely different. One patient after 2 months of fixation back to the normal life, another patient after 10 months of fixation cannot back to the normal life. And we to analyze treatment result of various amount of lengthening. Why? Because amount makes different according to the percentage increase in bone length. For example, what is 5 centimeters for different initial size? If we will take 5 centimeters for tibia 35 centimeters size, this is less than 14% of initial size. Same amount if tibia 30 centimeters size. 5 centimeters of lengthening is more than 15% of initial size. And for example, for short person, 5 centimeters lengthening for 25 centimeters initial size. This is more than 20% of initial size. Same amount of lengthening, different percentage from initial site of tibia. And when we to analyze some big group, more than 70 patients, all of this patient was less than 170 centimeters, and all of patient was so young. And we treat only with Ilizarov methods, with our osteosynthesis, and we delayed for all of this group to the 3 group. First group was lengthening amount up to 15% of initial segments length. Second group was the lengthening amount from 15 to 20. And the third group, the lengthening exceeded 20% of initial length. What is it? And what is it percentage? 15, 20, more than 20? According of classifications, drawer Paley, problem, obstacles, complications, and I am agree with this because during the treatment so many problems and obstacles, but only complications influence on the final result. And when distribute to amount of all of these groups depending on the amount of lengthening, on the first group amount was not so big, only for medical reason we increase for proportional treatment up to 15% of initial size. Second group, this is lengthening was more than 6 centimeters, and third group more than 20%, more than 8 centimeters. And you can see what is it, small amount or good result. When come patient before treatment and patient I want maximum. I'm all time show this picture. What you want? You want good or you want big amount of lengthening? This is absolutely different point and impossible get good result with big amount of lengthening. Patient want good result. And you see, on the first group, we haven't complications, very small amount. In the third group, we have 20%. Patient has some complications because our lengthening was more than 20% of initial size. This is our evaluation table. We calculate range motion of joint, knee joint, ankle joint, has patient deformity or haven't, and then we delete all of result like excellent, good, satisfactory, and poor. And you can see all patient has some results, and we not understand what is it. This is all patient. But when we delete to the group, first group has only excellent and good result. And you can see third group, half patient has satisfactory and good result, and only 20% has excellent result. This is depend how many centimeters we did. And you see, just now I won't show absolutely same amount of lengthening, 8 centimeters. This is guy from Pakistan but citizen on the England. We finished our treatment with 8 centimeters. This is up to 15. And his result was near excellent. Good position of foot, excellent position of function. We haven't any neurological problem. Muscles is good. Another Russian woman, and for her height and same amount of lengthening, she inside of second group from 15 to 20, and result was not excellent, only good. And this is guy from Japan, from third group, our 20% of initial size, and we get result, but so many times we go to the operation theater. We spend so big time for contracture of knee joint and equinus deformity of foot. But patient is good. But I prefer first group. This is patient from third group. And on the conclusion, we can say, if we length up to 15% of the initial length, we have only problems and obstacles, and no effect on the final outcome. At the same time, when the limbs was lengthened for more than 20% of initial size, the problems and obstacles often transformate into complications and reduce the quality of the final outcome. And I won't repeat it again. Our magic method, almost bloodless surgery, very strong fixation of bone fragments, elevate bearing on the affected limb, function of the adjustment joint, and post-operative adjustment joint bone fragments we can manage from the surgery time till the removal of the frame. And most important, as this is good rapport and understanding between the doctor and patient. I'm already show this, and same like Korean patient, she want before surgery 10 centimeters. When we measure her, maximum 5 on the final perfect result, proportional result. This is good communication between doctor when patient follow experience and knowledge of doctor. If doctor follow interest of patient, sometimes crazy idea, this result will not so good. We published our experience in the clinical orthopedic and related research, and some articles we have on the limb lengthening reconstruction. This is Indian magazine, and just now we select some material for another published, and maybe Dr. Barry will recommend me some doctor who can help me. I like this picture. Antonio Stradivari, violin, Nicola Paganini, sorry, and without hand of musician, this is only piece of wood. Without hand of treatment, this is only piece of metal. Our magic music in our hand. Nicola Paganini, 10-15 hours daily, make some exercise with violin. And Ilizarov frame only in the hand of doctor who each day use this frame can help us with magic orthopedic music. For me, this is my father, my teacher, my life, my home. Just now, one planet in the sky has name of Ilizarov. And with you, we can more than each us can alone. I invite you for collaboration, for cooperation, and exchange of our experience. Thank you very much, doctor. And if you have interest, we need continued our meeting. Thank you very much. Namaste.
Thank you, sir. Thank you for your fantastic presentation. Now, I would like to request Professor Mofakharul Baritser to share his experience regarding the cosmetic purpose of Ilizarov. Professor Mofakharul Baritser, would you please share your experience in the perspective of Bangladesh? So please first unmute yourself. You have to unmute yourself. Yeah, I think you have unmuted yourself, sir.
Dr. Barry,
Yes.
do you hear me?
Yes. Thank you very much. You have shown a lot of cases and very interesting. I enjoyed your lecture.
Thank you.
Now, you're in the show. Now I'm trying to show you something just to add with you. Okay. Oi, 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 oi. One minute. Yes. Screen share. Yes. Hmm? Can you see? No?
No, sir, not yet.
Not yet.
Not yet.
1 minute, 1 minute. Give me few seconds.
And this is for just a very easy procedure, but very, very difficult procedure. And if some doctor won't touch cosmetic patient, please remember about Ukrainian patient. Ukrainian patient lost life. I have few patients with very difficult result, very bad result, and only
আমার
after
টা share.
experience we have touched the
ওটা
patient.
কি করবো? Share দিছিলাম তো।
So, Professor Novikov, sir, is there any chance of common peroneal nerve injury during
Yes,
the
we
time
have.
of lengthening?
Second time of distraction, few patients we have with big amount of lengthening, with double level of lengthening we have. This reason
Now,
why I recommend only one level. And when we have some gap, we immediately decrease speed of lengthening with this propose, like you say, for neurological problem. 1 millimeters per day, usually patient cannot tolerate all period of lengthening. 2-3 weeks, then we decrease speed of lengthening.
okay, can you see my screen now?
No, sir, we cannot see your
Not yet.
screen, sir.
No.
Dr. Barry, I have same
Yes.
situation. 15 minutes I cannot show. Because
I
this
think
is
it will
Friday,
overcome.
Juma Namaz.
Juman was right. Now you'll be able to see.
Yes, sir, we hope so, sir.
Juman
We are
Namaz,
waiting for your slide. Yeah.
yes. Now I'm showing you. 1 minute. Juman Namaz Friday. Yes. Novikov rightly say. Juman Namaz. Oh.
Sir, can we discuss the cosmetic bone in the same manner as we do in case of traumatic case?
Traumatic case.
Yeah,
I not follow your question.
You just
Please
mentioned
repeat
earlier
again.
that yes, you just told us that 1 millimeter distraction after 2 weeks or 3 weeks, you just slow the process. And
Yeah.
then you will do less than 1 millimeter. You told us in your previous lecture that you will make a wave like this. Uh, Sometimes it increase,
Yeah, yeah.
sometimes it decrease, sometimes it increase, sometimes it decrease. Can we
This
follow
is
this
depend of
manner?
Now can you see?
yeah.
No,
Not
sir.
yet, not yet.
Not yet. Why? I am seeing a
Sir,
full screen.
yes, yes, sir, we can. Yes,
You
sir.
can
Yeah, yeah.
now?
Yes, sir,
Just
we
now we
can.
can see. Yeah.
Yes.
Okay. Okay, now I'm going. I want to talk within a very short time. Cosmetic dream and stature lengthening procedure by my lovely Ilizarov technique. Dear friends, especially Tanvir, Professor Novikov, and Dr. Shamsul Huda, I want to share my little experience with you. These are, you see, you can see the Kiev, my MS, during my MS in Kiev, Ukraine, in Uzbekistan, Tashkent, and my lovely institute, Kurgan, my lovely institute, our trauma center, at orthopedic in Dhaka, my working place, my private place. These are the Ilizarov you can see here. 4M and stature lengthening. A larger set of population with shorter stature are very unhappy about their height. They're not satisfied with the shape or proportion of their legs. May their height causes their psychological discomfort or some other reason makes them feel incomplete as a person. Patient with psychological state of short stature dysphoria seems to feel very odd there regarding their height. Some patients after adolescence do not feel that they have fully grown. In young people with stature shorter than average always feels themselves in anxiety and tension. Perhaps the limb lengthening surgery services may give a good solution. The decision to alter your legs for aesthetic reason, that is the correction of the legs or limb lengthening, is a serious one. What is limb lengthening? By a small incision, the bone is cut and a Ilizarov device is applied on limb. The device gradually pull apart the fragments from each other, leading to new bone. That is, we call it callus formation. Bone and soft tissues can grow under mechanical tension, which is very close to the natural growth and which depends on the law of tension and stress of the Ilizarov. Dear friends, we are happy that in my country we are doing a regular basis limb lengthening surgery. And in our practice, we've increased the height by 27 centimeter for cosmetic reasons. This was indicated because of obvious disproportion between the patient's body and arms and legs. Professor Ilizarov invented method destruction osteogenesis and proved scientifically that tissues can grow under law of tension. Under tension, that is Ilizarov's law that I told you earlier. And today, Ilizarov lengthening method is a well-known worldwide, is used to solve many orthopedic and trauma problems. Growing taller is similar to the Ilizarov reconstructive surgery, but there are certain technical and psychological differences. Different medical centers in different countries perform stature lengthening. And we have treated patients from different corners of the Bangladesh and other countries, Myanmar, Japan, and India as well. Our success rate, inshallah, is very high. Our reputation is worldwide known. We strictly follow the Kurgan teaching, the Ilizarov ring fixator for gradual distraction as well as consolidation. The main advantage is that corticotomy can be done in the metaphysis of tibia. The usual goal for lengthening for a stature for most patients with Ilizarov fixator is 2 to 3.5 inches. Our preference for tibia lengthening over femoral lengthening is because of several good reasons. Tibia lengthening makes one leg look longer than femoral lengthening. The reason for this is that the level of knees and the feet are obvious, but the level of the hips is not obvious. Technically, it can be performed in one operation in a reasonable period of time. There is much less blood loss in tibial lengthening. It is much easier and better tolerated to have two Ilizarov ring fixator on both the legs than on both thighs. Now, we shall have to ask some 10 questions regarding the limb lengthening. What is the limb lengthening? Is limb lengthening surgery painful? Is it possible to become taller by using tablets or exercises? which is the best available method for height increase, how much is the cost, and which part of the legs can be lengthened, how much is it possible to increase height, and how long does it take, is it dangerous, why does leg lengthening seems to be more common in developing countries, what is the physical activity of the patient after the surgery, in process of lengthening and after the treatment. Now let us see some case illustrations. This girl came to me at the age of 23 years. Her height was 5 feet, you can see, and she insisted me to go for lengthening. I told her, your height is 5 feet, it's okay for my country. No, she told me, doctor, I want to increase my height and I want to be more beautiful. And she was really a beautiful girl. And I started, before starting surgery, I counsel him, talk to this lady, young girl, and just explain everything regarding the limb lengthening process. Now, sequentially, you can see from left to right side, and a beautiful girl. And this is, I was talking about lengthening. You can see the two rings, and you can see here two, upper two, and telescopic rods. And now you can see 4 inches. This is too much I have done. Thus, this is not advisable, but patient is happy. Patient is happy. And this is, you see, 18 years old girl, 5 feet again, came to me, university student, and I started doing lengthening. You can see, after 2 months, and you can see, after 4 months, he could walk. What Professor Novikov told, you should have to see the 90 degree of the ankle. That is plantigrade position. If you have equinus, then it is very dangerous. When you're going for lengthening, you should have to see the equinus of the foot. Now, she is without any hesitation. She could walk with the help of this. This is the lengthening. She is a university student. And with this apparatus, she was going to the Dhaka University in the management department. Now you can see, dear friends, the ankle is okay, leg is okay, and very easily she is walking, she is stepping very nicely. And this is during the treatment, sequential stage. You can see a little bit callus formation from side, disturbing. Now it is okay, 6 months. And this is 5 feet 4 inches, lengthening of the same girl. And this is the girl, she is starting in UK. She wanted to do for lengthening in UK. That's very costly. Can you imagine? They take 6 centimeter, near about 80 to 90 lakhs taka. My Bangladesh taka. It's too much. Then came to my place. Now she is in England, and I have started lengthening. You can see during treatment with the Ilizarov apparatus. This is the sequential, and at the same time, she is doing exercises in my room. Now see, exercise is very important. Fundamental principle of Ilizarov methodology is load and motion. Load plus motion, it gives healing. Now you can see how she is walking with the Ilizarov apparatus in both the legs. So this is, I'm checking, mother of the daughter, mother of the that young girl, and you can see now after removal, I've increased 6 centimeter, 2.2. This is enough for her. With this, she can use a little bit, heel. That is, she's taller. She's very happy. She's very, very happy. Now you can see here. This is the final. She was 4 feet 8 inches, 5 feet. This is a doctor from another district. Then I lengthened her. You can see in the left side. And this is the clinical follow-up. After 2 months, 2 inches lengthening was done. And at the same time, I always allow my patient to go for exercises. Look at the ankle and foot. when you are going for lengthening, you may invite equitis. To overcome that, you should have to continue the exercises. So this is the, you can see the consolidation, callus formation, and this is height is increased how much, and this is also she was starting in UK, came to my place. They are taking too much money. Then I started lengthening. You can see when she was a little bit non-cooperative, and that's why a little bit problem with the equinus. And initially it was that, and then finally we overcome that one. So this is the C after total height increase. So pain is a chrysalis process inside the mind. In lengthening process, patient-surgeon interaction is very important. You should have to talk with the patient before going for surgery. A cosmetic lengthening is an access to human understanding and the dream of the patient physically and mentally. Success comes from hard work and meticulous follow-up of the doctor, and at the same time from the patient side also. The Ilizarov frame is strong enough and can walk with full white beard. And this is also published, published in 2017 in American Medical Journal. And I always love to show this one. And I always deal with the three. If you think about the easy, difficult, and impossible, you should have to go ahead with the difficult cases. And this is the how you can get peace when you are dealing cosmetic lengthening is not a very easy thing. You can see you should have to fight with the Ilizarov apparatus for achieving good result. If you increase the patient, it gives a patient's leg or patient, if you increase the height, it gives him or her a satisfactory result throughout the whole life. And this is my center, Ilizarov. Okay, and this is books and my all good friends from Kurgan. You can see with our most senior surgeon, Professor Shamsuddin Sir, and other Kurgan fellows. These are the other fellows, and I'm always grateful to Professor Ilizar, Professor Shepsov, Novikov, Gubin, other friends for our cooperation all the time. So thank you so much, dear friends. Thank you for giving me the chance to talk on Cosmetic Dream.
Thank you very much, sir. Thank you for your magnificent presentation regarding the cosmetic lengthening in the perspective of Bangladesh. We don't have any more time as because of we have two presentations today. Hope we will discuss it in the next session, in the coming Friday. Dear viewers, today we want to end up with this presentation.
Can I have a short question?
One more question. Yeah, please. One last question, please.
Yeah, thank you, sir. Thank you, Baris sir, Navikov sir, for our wonderful talk, sir. I'll just ask a short question. In India, we are having medico-legal issues regarding cosmetic lengthening besides diseases. What is the medico-legal aspect there in Bangladesh and Kurgan? Because we cannot do on an average patient having a psychological stress is very important because lengthening and giving another complication is very bad. We have got so many cases of shoes in cases. What is the views of the medico-legal aspects for cosmetic lengthening, sir?
We don't have any rules and regulations for medical legal aspects in my country. And if patient wishes his surgeon experience, you can do that. But in India, I know the one surgeon they started doing, and there is a complication for that. It arises. Yes, I know that one. It's okay. Some countries they don't allow, but in Russia, in my country, we can go for lengthening cosmetic. What about Novikov?
Novikov, sir. Novikov, sir.
Sir, you have to, Novikov, sir, you have to unmute yourself. Novikov, sir, please unmute yourself.
Because here in India, we are doing with the diseases like polio, achondroplasia only.
And just now you heard me,
Yes, sir. We
Yes,
can hear you,
colleagues.
sir.
sir. Any
And
about the medical legal issues, sir? Any?
if colleagues, if patient has disproportional, doesn't matter which his height, for example, 2 meters, and his win 2 meters 10 centimeters, we need support them. If some patient has 150, but this is patient inside of gold section, not touch them, because each hour centimeters will go away from disproportional. For me, with my age, with my experience, I will touch only patient, not patient, healthy person who has medical reason. I calculate, I measure. If there's some reason, not only money reason, I will touch, I will help. And remember, this is any surgery. We cannot back. If just now I will broken, this is will never like before. When we touch healthy person and when we broken bone, will never like before. And before surgery, we give few days for thinking. We open all our cut. We explain all of our experience, difficulties, including problems. And when we talk about complications, why I decrease my amount of lengthening? Because 3-5 centimeters possible. Just now, if I want increase space between my hand, I will damage this soft tissue. After my experience, after 5-6 centimeters, all time doctor has problem and complications. What patient want? He wants centimeters with complication. I no want. I want to be master. And if I know with this amount I will have complications, I will never go, because this is my name. With my age, I want finished only with excellent and good result. Sorry, small amount of lengthening. Sorry, only with medical reason. Doesn't matter how many money patient won't pay.
One very short another
Because
question, sir.
I listen to
So
you.
thank you.
Yes, sir. Sir, what is your view about lengthening of a nail? Many of us are doing lengthening of a nail in India, and in the US we have precise nails. What is your views about that, sir? Lengthening of a nail.
And the nail, we have only one patient. 3 years we treat complications. After that, and bone marrow for me, holy cow. I no want touch bone marrow. I no want disturb. I no want damage bone marrow. And for what? And you see, why doctor remove external fixator? Because all of orthopedics talk about time of osteosynthesis. For
Exactly,
how
sir.
many months you put nail? Sometimes 1 year, sometimes 2 years. This is period of osteosynthesis, very dangerous period. I no want that, because my father says bone marrow, this is mother. Mother is mother everywhere. If doctor prepare, and one more, when I treat with external fixator, this is my this is my duty. I won't spend time. I want to be near the doctor, and this is depend of doctor. I think if doctor has enough experience, if everything is good, why not? But for me, I will never use this technique.
Thank you, sir.
Thank you very much, sir. Thank you, Dr. Shamsuluddha, for asking nice questions, and thank you, Professor Navikov, sir, for sharing your experience with us. Dear viewers, at last we came to know that we can do the cosmetic lengthening by the magical Ilizarov. But first, we have to discuss these things, the complications with our patients. And we have to take care of the medical legal importance. Definitely, if there is any rules and regulations in your country, then you have to follow your rules and regulations. But we can do many things by the Ilizarov, like the cosmetic lengthening also. So hope we will see you in the next Friday with another topic. Till then, I'm Dr. Mohammed Tanvir Ashraf. I want to say bye-bye from Orthopedic Solution Academy to you. Bye-bye, everybody. Bye-bye. Thank you.
You are
Bye-bye.
watching Raj TV, Jagorone, Bangladesh. Please subscribe our